Thank you very much for your patience, and thanks too to the IT guys that have sweated here for the last 15 minutes. So good afternoon. The majority of our audience this afternoon are actually trying to webcast, so thanks to your virtual people out there who are webcasting. I hope you've all got an agenda. We will be following the agenda today. And also for your information and for those listening in online, this session is being recorded and will be uploaded onto the APHCRI website for your convenience later. So referring to the agenda, our presenters today are Mr Bob Wells, who's the Director of APHCRI, Vicky Murphy from Doha. We also have Jan Williamson from Doha in the audience, so thank you for coming, and Peter McInnes, an APHCRI link with Doha now, which is great for 12 months. Mr Will Wright, who is going to be moderating our questions and answers later on, and myself. So with regard to the agenda, Vicky and Bob will welcome you properly very soon. Then we'll be looking at how to prepare the application and some of the things that are different from this round to last round. And we'll do the questions and answers at the very end so that we can get through all of our information first. So Vicky, if I can ask you to come up and take over.
Right. Can you all hear me? Thank you for inviting the department here, Department of Health and Ageing. I'm pleased to be setting aside Bob Wells. This strategy around development of Centres of Research Excellence has been a joint piece of work over the last probably 18 months with APHCRI, and we're pleased that our contribution to this particular component of the PCREs strategy has come to fruition. First of all, I'd like to start by saying that the Commonwealth Government, as you know, has funded the PCREs strategy for over 10 years to about $135 million, which is a substantive investment for us into research. The PCREs strategy funds a number of elements: the Australian Primary Healthcare Research Centre Institute, PCREs in South Australia, in Flinders University, and also funds the remaining research capacity building initiative, which, as you know, concludes the end of this year. And we still have some small fellowship and scholarship arrangements in place at the moment. But in July last year, the Minister for Health and Ageing, Minister Roxon, made a policy decision to redirect the RCBI money that's available into a competitive grants program and to begin a program for Centres of Research Excellence to be administered by APHCRI and to start in 2012. And I guess that's what you're all here today for, and to hear about this second round of CREs and what we're expecting of them. Doha has vigorously supported the ongoing funding of the PCREs strategy, which has three main goals: build capacity in the primary healthcare research sector, generate high quality and robust evidence and research to add to the body of primary care knowledge already available, and to actively disseminate the research and promote knowledge exchange. The selection criteria for the Centres of Research Excellence, which you're all about to hear from Bob about, articulates in its requirements this ongoing arrangement for capacity building as part of the CRE network. For disseminating research and promoting knowledge exchange, the PCREs strategy is looking at PCREs in South Australia to take a lead role, although obviously the role of the individual CREs and APHCRI are going to be just as important to disseminating the knowledge that comes from the CREs. Thus, generating research knowledge is the sort of thing that we would like the CREs to continually to focus on, and what I'd like to discuss further with you today. Doha, as you know, the Department of Health and Ageing and the government is fairly actively involved and intensely involved at the moment of implementing some of the major reforms in health in Australia, and particularly in primary health care, which is taking, as a result of the Minister's recent announcements, is taking a real priority focus in reform across Australia. In terms of primary care, we need some of the tough, big questions answered, and we see that some of the CRE work will actually give us that capacity to have some of those questions answered. And some of the sub-themes which will be falling out of the CREs are going to be important to supporting the implementation of research. Research around Medicare locals, how they operate, how they work within the primary care sector is going to be a significant work for us. Multi and interdisciplinary teamwork and care delivery models will be important. GP super clinics and the role they take in primary health care space. After hours access for all Australians will be an important agenda for us, and the enhancement of the role of nurses in the primary health care system will be just as significant. There's also much work to be done in the areas of chronic disease, maternity services, telehealth options, work around e-health, the personally controlled electronic health record, Indigenous primary health care, clinical and administrative governance are all issues of significance in this current reform agenda. We are looking for innovation. This is specifically to be addressed in the application and selection criteria, and it's important for you to consider as you develop your CRE applications. I would also like to draw your attention to page 6 of the application process, which is around knowledge generation. This will be a significant component for us in any CRE. Clearly not all the CREs will have a focus on those topics I've mentioned, but they will pick up many of the issues around implementing the health reform agenda. And in addition, I think some of the work in the CREs will actually set some of the focus for further policy work in the future. Where do we go from this current large investment of primary health care research, and what is the future policy agenda? And we'll be looking forward to some of those particular issues. However, to summarise, what the Department is expecting from the CREs that will start in 2012, I would like to include in these elements and to summarise those for you. We want real opportunities for primary health care researchers, particularly at the postdoctoral level, to participate in meaningful research projects under the leadership of a chief investigator. We want research projects that are relevant to the continuum of health reform and its implementation and sets the future policy directions. We want research collaborations with associated primary healthcare sectors such as nursing, allied health workers, consumer groups, policy makers and divisions of general practice and Medicare locals. We want the preparedness to share these findings and knowledge within the APHCRI network to be widened. And we are really focused on the fact that we can do a lot better in that knowledge dissemination and how evidence is applied to the field. We're extremely optimistic that the applications that will be submitted for the CREs will be administered well by APHCRI and that they'll start in 2012. And we will well thought through, and we're looking for some clever and innovative aspects to our research approach, and we're obviously expecting some very high quality in the field as per the previous round that was run by APHCRI here. The investment of the Commonwealth monies into primary healthcare research over the last decade has set the scene for this competitive and forward-looking process, and we're pleased to build on this process and to build a successful network of CREs across Australia. Before I conclude and hand over Bob, I'd also like to mention again our investment into this whole agenda is being supported by the Department seconding a senior officer from the Department of Health and Ageing, which is Peter McGuinness, which was just mentioned in the beginning. Peter is here to work with the APHCRI network. He's based in the ANU with Bob's team, but we'll be working with the individual CRE and APHCRIs to ensure that policy engagement and the policy linkages and the commitment that we promise to give in that our policy time is available to this network to deliver research which really will take us forward in the future. I'd like to hand over to Bob. Thank you.
Okay. Oh, thank you, Vicky, and thank you, Dagmar. Thank you all for coming, and thank you for those who are or will be online at some point. First of all, I'd like on behalf of the University to acknowledge that the traditional custodians of the lands we're on, the Ngunnawal people, and we acknowledge and respect their contribution over many generations. I'll just talk a little bit about the APHCRI strategy, Primary Healthcare Research, Evaluation and Development, which Vicky mentioned. I think to understand what APHCRI is on about, you have to really understand what the APHCRI strategy is, and I see that more akin to an R&D component of an organisation rather than to a research along the side like a competitive organisation like ARC or NHMRC. So the R&D departments generally improve the products an organisation has, and products in this context are policies, and improving them, I guess, is finding better ways of implementing them or reforming them in a way that makes them more effective, and to develop new products down the track, and that's the forward-looking part of this APHCRI strategy, is that we're not just if you like, researching for the present. We're undertaking research that will inform about issues that are just on the horizon or even over the horizon, and will be important in their time. So an important part of APHCRI then is, as one of the key elements of the APHCRI strategy, is to